Good afternoon, everyone. It is our pleasure to be with you. But Jill said that you all were interested in hearing about interjurisdictional placements and how to do them more effectively, efficiently, and whatever. And we talked about a lot of different ways that we could come at this. But as we prepared and talked further, it just so happened that this workshop was going to coincide with the debut of our new interjurisdictional curriculum and DVD. The curriculum, you have a flyer on that was given as a handout that talks about it. It is being proofed as we speak, and we expect that it will be up through our internal process shortly and on to our federal project officer, who is also your liaison as well, and very shortly. I would imagine within the next couple weeks. So Heidi, be prepared. But it is our pleasure. But we wanted to, but you all have a special treat because nobody has seen this 20-minute video publicly. So you all, and we also have extra copies that are available for you. And you all, hopefully you picked up a copy yesterday at your seat. But we do have some extras, and we will of course have even more within the next week or so. So we hope that you enjoy that. But before I say any more about one of the things that Jill did mention that you all were interested in is learning more about purchase of service, especially as it came to interjurisdictional placements. And one of the other things that we gave you today was a copy of our guide. And Deborah, may I borrow yours, please, a minute? This has been around before. How many of you, I don't know how many of you have seen this, but Dollars and Cents Guide, a guide to achieving adoptions through public-private contracting. Now, we have lots of materials. I mean, we have many publications, and you probably have at least one copy of them all in your offices. But if you really, they are rich with tools and resources and tips and tools, so please just take a look at. That's why I gave you a new copy, just to make sure this one doesn't have much dust on it. But you know, that will tell you and give you information about you know, doing purchase of service in regards to, in particular, in interjurisdictional placements. And lastly, one of the other things that we have available always is this DVD, and if you do not have this has all of our publications on it, and so rather than lugging all the publications around, this is also available, as well as they are available for download on our website. Okay. Let's see, and one other piece of paper you were given, oh yes, and Tamika's going to talk with you a little bit about that. But those other two pieces of paper we'll talk about in a little bit. But I wanted to just kick off our session today with we took the title, the beginning title of the new interjurisdictional curriculum and DVD, Beyond Borders. How do you take it to the next step? And that really is what we heard in one of the things that we kind of heard in the conversation that we had with Jill, and I think maybe even Ann at some point, about what it is you all were wanting, how to make it real, how to have it happen. So that's what we, it just really fits nicely with the theme. In case you don't know, and we really should begin to give tests on this because people get confused about all of our services. And while this may be familiar to you all may have seen this little diagram before. We've repurposed it a little bit because we felt it was important that it's not so important who the players are, because we are all Adopt Us kids. But what is important is that the comprehensive and rich resources that we all bring to you. We are all available to you, and there is no wrong door. And oftentimes you all can seek our services through the NRC. But if there's something else you need, we can hook you up with any other partner. But I wanted to also lift up some of the other services that we have as a part of Adopt Us Kids in case you haven't utilized them us in this way before. I'm going to begin at maybe about 11 o'clock where the NRC, what we do is what every member of the TNTA network does, is that we help build your capacity in the forms of recruitment and retention of foster and adoptive parents and kinship families. And I'll let Tamika say more about that if she'd like. But how many of you in this room have had us on site? And those of you who know, you know what we can do. I mean, we don't just say, here's a list of recruitment activities that you can do, go forth and do good. No, and oftentimes the question that you bring to us is not the place that we start, because we want this to be long-lasting and not just a flash in the pan, as one state said to us, and that we wanted to build your internal capacity so that you don't have to, keep coming back for the same thing, so that you can, as a result of the services that are provided, that we can truly initiate and help you initiate systems change. We have a tremendous outreach and response to awareness raising in media opportunities. You all saw at the luncheon on Monday the new ad campaign. Weren't those awesome? I have to say, I have favorites from each of the other ad campaigns, but I don't know that there was one that I did not like this time. I liked them all. So I'm real excited to seeing those. Next, because we are the national photo listing of kids, we have, Kathy Ledesma, our national project director, she does an interview. I think she does 2-3 interviews every month, it seems, with different media sources. And so we have a listing of a host of media families that are available. So anyway, people come to us and want to know what's happening with adoption. Anyway, we also have the toll-free number for families, that they are the response and the fulfillment. We also have that kind of cut across all of us, the capacity building with special communities. We are putting emphasis on 5 communities that have been most underserved with families, and that's African American, Hispanic Latino, Native American, LGBT, and military global. We're going to touch on a little bit of that with the military global in particular, since it has to do with interjurisdictional. As I've mentioned before, we've had many, many publications. Dr. Ruth McCroy is the head of our research team at the University of Texas at Austin. And we also have a dynamite parent respite program, and we have provided respite grants to probably, I think, about 80, 60, something, I don't know, 5 years. So, so we're well over 50 or so respite grantees, and these are parent groups who are in partnership with states. So if you know of a parent group, if you don't have a respite program in your state or your jurisdiction, and you know of a parent group, and it doesn't have to be a 501c3, I don't believe, because it's in partnership with you as a state agency. But if you know of a parent group that would be interested in developing a respite program, we have grants that we give to them, and not just grants with technical assistance, and then they in turn talk to us and give us information about how you hang on to families and how you strengthen your system. So that's a wonderful, wonderful resource. And last but certainly not least, we have our website, adoptuskids.org, and we also have the Spanish website, adopteuno.org, as well as social media. And I don't know if those of you who had a chance to come to our workshop on social media the other day, but there is, the whole, whether, I'm an over 50 person. So Twitter and Facebook, are, I cringe. I only have a Facebook account because my daughter set it up for me and said, you need to have one. I might check it every month, but it is what it is here, and it's here to stay, and so it is a tool, and so we have resources currently, and we're developing either more resources on how to utilize this tool in the recruitment and retention of families, and there are some exciting ways to utilize it. So, this old dog is going to have to learn some new tricks. So with that said, I'm going to pass this on to Ms. Tamika, superstar, and I'm going to have to bid you adieu because I have another meeting, but she's going to take good care of you. Thank you.
Thank you, Ms. Black. We do thank you for the opportunity to be with you today, and we certainly appreciate the outreach that Jill did to us because as it was an issue or something that from your NASAP planning meet calls that you had, you knew there was a lot of interest in interjurisdictional placements and helping children and families connect who do not live within the same state and across different state lines. And sometimes we know within the state there can be some issues with trying to move children from county to county, but certainly across state boundaries has been an issue. So we certainly welcome the opportunity to come and have a few short minutes with you to talk about some of the things that are happening in interjurisdictional placements. We do have the curriculum and this DVD that have been developed to help along those efforts because we do not want it to go away. We do not want the conversation to stop because we do know, and I'm going to go over these numbers to see why it's really important to all of us that we continue to pursue interjurisdictional placements. Some of the information I'm going to share with you right now is from our website and what we know. Our website is one indicator that we can use to see what's happening with potentially the children who are registered, photo listed, that are legally free for adoption and are waiting for permanent families. So according to our numbers, we've, since 2002 to the current date, of course, some more have, I'm sure, arrived today, we have 30,842 children, waiting children, have been photo listed. We have over 25,000 home study families have been registered. We currently have about 4,500 families registered. 1,050 agencies have registered to be participants on the website. As a resource, adoptuskids.org has over 250,000 average daily unique visitors per month. So we got plenty of traffic coming to the Adopt Us Kids website, and folks are coming and they are saying to us that they are interested in adopting the very children that we say that are legally free for adoption. And when we encounter them, as you've heard, and as I'm sure as you hear, they want to know what the obstacles are and what are the barriers. If they say they have an approved home study and they are ready to parent children, why is it that they're having extreme difficulty having those children placed with them when they've been very patient throughout the process? So that's part of what we're going to get to some today. One of the things that we're very happy about that since 2002 and what we can document, that approximately 13,700 children who were waiting and were photo listed on Adopt Us Kids have been adopted. And another unique statistic with that, 52% of those children have 2 or more identified disabilities. Sometimes there's an opinion that they're not interested in anything but, healthy children with no issues or disabilities. And what the stats we have said, they are willing to parent or have adopted children with 2 or more identified disabilities. So to that, what happens with families when they come to our site, we have a piece about response and fulfillment. As you know, when folks register, they will call our 1-800 number, and they may be asking for some types of information. They want some tips about how to negotiate the process. As a part of what we call fulfillment, we field those calls, we try to get them information, and then we try to point them in the direction of where they need to go to whatever state or territory that they're interested in working with, and with those contact people in those areas. So that's part of the information that we provide to them. What we began, and this is in your what Shari passed out too, we gave you a copy of Campaign Fulfillment like this. And this was in, do most of you in here receive our e-notes publication, electronic notes? Great. So this was actually in one of our publications, and it talks about campaign fulfillment. What they started doing most recently is when they have a family that's registered, they have followed, and they speak to September. There were over 50 new families registered, and what Stephanie's team did was they contacted each one of those families and provided follow-up with them and gave them those types of tips and information of what they could expect once they became registered on the site, and how to make some of those preliminary contacts with states, and just as a sounding board and a resource for them, because we know there's sometimes a lag in time, and we see the need to have some type of response, and and we've stepped in to be able to do that and provide them with some of the information while they wait in the process. In doing that also, we have some follow-up that we will provide to the state that we're working with to share some information as to what we know. And what I just did was I highlighted some of these things that are on this sheet, but basically it tells you some of the information, and you'll see more of this tomorrow. It tells you some of the information that they're sharing with them and how through Adopt Us Kids and the website that we could be of assistance with making sure you have some information at your fingertips. You don't have to do a lot of research and everything on your own. We can tell you about who's using your site, how many families have been registered within your state, and what types of children that they're interested in parenting. And we can easily provide those types of statistical analysis for you as you're going forth with your work. It's there for you free of charge. Just give us a call with it, and you'll hear a lot more about that tomorrow. So knowing that there is a certain need in the community, one of the things that we did also want to do is to develop this video and curriculum to help with the efforts along the way. And as Shari said, this is the first group that's had an opportunity to see the video. We had a 3-minute clip that we showed yesterday, but I really wanted to give this group an opportunity to see the 20-minute, the whole thing, because you're going to be the carriers of the message. We want you to have it in your states. We want you to certainly use it. If you need technical assistance, we certainly want you to pick up the phone and call us so we can help you with this. But we feel as if you get a chance to see it and you see the richness of it, then it may inspire some things. And we're going to have some discussions about this afterwards, too, with some of the activities, at least one activity that comes out of the curriculum. So I do think that's the next thing I am going to show you is the video, and you guys have to promise that you will not fall asleep while we're watching a 20-minute video. So I think I can play this. I had some issues with this a little bit earlier. Let's see.
75% of the inquiring families who contact the adoption exchange about one of the children who are waiting do not come from the same state as the child.
We need to think of the children as our children. They're not New York's children, they're not Kentucky's children, they're not California's children, but they're our children, wherever they may be. And that all our children need and deserve a permanent home.
And foster care is meant to be a temporary safe haven for children, but it is not a permanent place to grow up. And children need the permanency of a home that is going to give them not only legal permanency, but also emotional permanency. And what that means is that a child has a place to belong and a place to call home. And also, all of us get our identity from our families. And it gives us a sense of self and a sense of where do I fit in this world? Where do I belong in this world? And every child really has a fundamental right to grow up in a family and to grow up in a permanent, loving family.
I once worked as an adoption advocate. Avocation rather than vocation. And I was talking about a little boy that was in Oregon, and the couple that wanted to adopt him and it looked like they were going to be approved to adopt him was in Pennsylvania. And I was talking to the worker, and she said, "Oh, Barbara, That's just so far. That's just so far away. And I understood her because she had a vested interest in this child. She had been this child's worker for a long time. And she was worried about him going somewhere. But I had to tell her, I said, don't worry about him. He's going home.
Sometimes there are barriers to placing children across state lines. I'm sure we all know of some of the barriers. The first thing for me as being the caseworker of this young man was the thought that, okay, it is okay to let him go. It's okay to let him cross the border. When you are a caseworker and when you invest so much time in a case, you take ownership of that case, you know, right, good, bad, or indifferent. That's something that sometimes happens with caseworkers. If you have gone through and you've worked with their biological family and you've gone through and you've looked at, you know, making that decision to terminate parental rights, well, you want to make sure that the family that has that child or that young person is going to be the best family possible. And in my own mind's eye, it was the thought of, well, how can I ensure that if this person lives in another state? So the first thing I would have to say, and this is being honest, was just to look inside and really with coaching from my supervisor, good clinical supervision, to really look through those issues of ownership that I had to make sure that, you know what, it's okay. Let me not let my own lenses stop this young person from having a forever family.
Many times you meet resistance in that they're intimidated by the amount of paperwork. They are scared that this is going to be another failed placement for this child. And not only is it going to be another failed placement, I'm going to have to go to California or New York or Florida to go get this child, to bring this child back. So there is some initial hesitancy.
When we talked with the supervisors and regional office staff and caseworkers, they had this feeling that the practice might not be as high in another jurisdiction as what they would provide for their children. So there was a certain apprehension about one another because we were from two different states, from two different bureaucracies with two different sets of guidelines.
Do we consider a family out of state, and how do we get past our own biases? I think social worker biases come into play a lot, but that we have to think about these children and that we have to put our own fears, our own biases aside and think about these children who need the permanency and who probably have the same fears that we do and worry about what's going to happen.
It has to be a top-down in organizational leadership. And I don't just mean within the child welfare agency, but from the very top. But then we also have to have that supportive infrastructure. How is the agency organized? Are the ICPC and ICMA units within the program units in the offices, both at the state level and at the county level?
Regarding interstate placement, one of the most important things that can take place is continued education of the judges and judicial officers in the resources that might exist over state lines for the children in their care. Judges want children to achieve permanency just like everyone else in the system does, and if they understand the resources that might be available in either familial placements over state lines or even adoptive placements over state lines, they will help the system move forward to achieve that.
Anyone who is involved in the process of placement should have some knowledge of the interstate requirements. I think it's important for them to understand the process, understand what is required, how to fill out the forms, understand that there is a process in the receiving state when they're doing it, that they have to go through their state process as in our state.
I was so thankful for a supervisor who was willing to walk that journey with me and not to simply discount it, and that supervisor being able to walk through my concerns with me and help me see a different side of things to help me grow as a practitioner.
It's important that we be prepared to answer questions of a caseworker who may never have done an interstate adoption before, so that we can help identify resources, public and private resources, community resources, not just government resources, in the state where the family lives, as well as the state where the child lives, because it's going to take a lot of cooperation to make the adoption happen.
If you have a problem with the ICPC, call your ICPC commissioner, director in your state. They want to help. I know from talking with any number of them that they want the opportunity to move these cases appropriately and properly through the system. And while they may well be overloaded, if it is the kind of case that has been hanging out there too long, they're the people that want to get that case moving.
And it's nice to connect with the workers in the other states to give them information about how we work. So in the future, when there's future placements, they're aware of those procedures and different steps that they can take to help accommodate certain things.
It also helps to know if there are some medical assistance needs or needs medically that we haven't maybe touched on or been aware of, and so that we can also be helping the family in that way to have a successful placement and hopefully provide permanency for the child.
The agency really has to believe, the public agency does, that there is much to be gained from working collaboratively with private adoption agencies for the placement of children. And to support those relationships, we need to have a quick purchase of service or ability to contract when a placement decision is made to place a child in another state that requires services by another provider.
I really do believe that there has to be a personal touch in all of those placements. And our local agency that does most of that is responsible for providing the information and so forth in regards to the children, they feel comfortable in knowing that if they're having some difficulty, that I can contact my counterpart in the other state to make sure that the children are being cared for, or that if there are some unmet needs, that they are going to make sure and help us kind of bridge the gap for parents, adoptive parents.
And we were looking at trying to increase the cross-jurisdictional placements of children between our two states. When we first started meeting with one another, one of the first things we did was really get to know each other. And I think we began to build relationships in those meetings and to build trust. And once we began talking with each other and talking about our policies and procedures and legislation, they were different, but they were not contradictory to one another. What we'd found was that the barriers were more traditional. The way we'd always done things was more of a barrier than our legislation, because the policies and procedures and legislation were basically geared toward the same end. They were trying to find adoptive homes for children.
What made it successful was perseverance by the worker and not letting the idea of finding a good placement for these little girls go. And she just knew that if she kept looking, she could find somebody. So I would say perseverance, tenacity, and a knowledge of how to get that information.
So sometimes we get very provincial about ownership of our children. I know we do in New York State or counties, and it's loosening that up, working with other states, having, as I say, better communication, being able to quickly facilitate that process and find out about an adoptive parent in another state and make it happen. Make it happen for our kids. It's all our kids, although we have states and territories, but it's all U.S. kids.
When an interstate placement is really what's been identified as in the best interest of, or potentially in the best interest of any particular child, then I think there's really just one important rule of thumb to keep in mind by everyone, whether it's the parents caregivers, whether it's the social worker at the line level in either state, supervisors, administrators, interstate compact workers, judges, lawyers, all the different people with all their different roles. Really, one rule of thumb for everyone to keep in mind is to never say never, and conversely to never say always. And so what I mean by that is that each case is going to be individual, and you are going to run up against some challenges. Wherever we're crossing any of those jurisdictional lines, we will run into challenges, so we need to expect them. And then we really have to have that, what will it take to make this work? And sometimes that means exploring something we've never tried before. Sometimes it means bringing in some support or some help from someone that we haven't had to tap before. Whatever the challenge is, instead of saying, well, we can't do that, say, someone must have done this before or something similar. Where can we find out who's done it and what will it take so we can do it? If it really is what's best, there will be a way, but it's those nevers and those alwayses that tend to really create the barriers.
I think what really makes an interjurisdictional placement work is communication, communication, communication. That has to be an essential on part of all the parties involved.
Workers are looking out for the benefit of their children they have on their caseloads. They care very much about those children and feel responsible, and rightly so, want to see that those children end up in a permanent placement that's going to be very, very wonderful for the child and for the family. And so for us to be able to communicate very well a picture of the family, and I don't mean just a photograph picture, but a complete picture of who this family is, what their home is like, how well prepared they are to adopt this particular child into their home, that raises the level of trust and then breaks down some of those barriers of the distance that is between then where the child had been residing in foster care and where their new adoptive placement might be.
In doing these interstate adoptions, one of the things that we're trying to do is have a cover sheet that talks about our agency and how many interstate adoptions we've done, and the fact we understand the process, the fact of what our responsibilities are, how we're going to handle the post-placement. Also, having little bullet points of why we think this particular parent is a wonderful fit for that child. Mentioning experience with children or education at the front, so they don't have to plow through the home study in order to find it.
It really needs to start with good preparation of the adoptive family and providing them all the information on the children, and having workers and professionals even take the time to really explain to the family the children's needs and what that might look like in terms of children's behaviors, so that the family is really well prepared to receive the children and to know that that is a commitment that they're ready to make. It also takes good preparation of the children and doing good therapy work and transition work with the children to help them with their issues of grief and loss and to make sure that they're ready to make that move.
There was a child who had a sibling that already was in a permanent home, wasn't moving or leaving that home, but that family wasn't going to take this other child. So whatever happened, these two siblings, unfortunately, were going to be separated no matter what. And the family that was being now considered for the second sibling did live in another state. And so that issue of the sibling relationship was really one of the challenges that we all believed we have to keep these siblings connected. We asked the two children, what will most help you to stay connected even if you don't live near each other? And they said, well, if we could text each other and if we could have those kind of, computers where you can see each other when you talk, then we would be happy with that. And so we really looked into that, and we found a way to, again, through private donations and other sources, to get the girls each a computer with a webcam. Not very expensive, by the way, and cell phones where they could have a texting plan, and they could stay in touch and feel connected.
When Congress passed another important act, the Children's Health Act, that law created a national adoption exchange to encourage the interjurisdictional placement of children. That national adoption exchange is what is now known now as Adopt Us Kids.
There are families on the Adopt Us Kids website who are approved to adopt, and by virtue of the fact that they're on that website, they are willing to take children who are older, who are members of sibling groups, who are children of color, and the Children's Bureau has committed to do a national advertising campaign and to fund Adopt Us Kids' national photo listing website. These are resources that are available, but these resources are vastly underutilized, and it takes the staff and the states to use these resources in a serious effort to really try to find homes for children.
There's a lot of technical assistance available through the National Resource Center for Recruitment and Retention of Foster and Adoptive Parents at Adopt Us Kids. And chief among those things are guides that have been developed over the last few years on various aspects of placement of children and recruitment of families. All of these guides are available at no cost on the Adopt Us Kids website and are used in on-the-ground technical assistance provided free of charge to states, territories, and tribes.
I want a permanent home, not just moving around place to place.
We want to be able to feel secure somewhere. You're not going to know where you're going to be at today or tomorrow.
Because once you get bounced around so many times, you finally give up and say it's not going to happen.
For all of the roles that we play in the lives of children and families, from administrators to providers of services and so forth, the one unacceptable role in child welfare is that of a spectator. We can never sit on the bench when it comes to the life of a child and the well-being of a family.
These are our children in this country. These are not children from one state or another. These are children who need to have a family, and if the family that they need is in a different state, then we need to help them get to that family. We need to help them find a place to call home, and we need to work together to reduce barriers and to get children into homes where they belong.
The agency really needs to have an attitude that they are looking for the family that is best suited to meet the child's needs. The geographic location of that family is secondary or should not be a consideration at all.
Social workers need to put down their own biases, their own fears, and really put the kid and think of the kid's fears and see why it's so important that we do and make good matches. They do happen. They happen all the time, and they're what's best for our kids.
We have to believe in the possibility. Parents and children don't care where one another comes from. It's a cross-cultural adoption if it's across town, because it's so different than the family they came from. And so when they look at a map, they don't see all of the barriers that we see and all of the funding streams that cause us to stop at the border. And we have to be able to see it the way they see it, see beyond that, because love doesn't know boundaries.
Anything jarring, anything stand out to you that points of consideration?
Since I could address this all, why I wouldn't place my child across the lines. I mean, I think it's pretty effective that way.
Mm-hmm. Thank you, John. Okay, there we go. Yes, ma'am.
I thought it covered a lot of issues, and they're very good issues. One thing that resonated with me is something that we talked about earlier today, and that is having the meeting or having some kind of forum with the ICPC and the ICMA folk, because we just, and I know we raised hands this morning. There are several people in the room who have those services, have at least ICMA under them.
Mm-hmm.
But in those states where you have different managers for ICPC and ICMA, then we need to have the conversations to make sure we are all moving in the same direction for the children that are coming in or going out of our state. So it was good to have it up there.
Thank you. And that piece was a part of one of our earlier discussions too, is that the role, of course, that ICPC and ICMA plays in children being able to go across state boundaries, and the time in which that work does that is able to happen. Any other feedback? Was there anything in particular that, one of the things I think in doing this video, and if, I don't know how many of you participated in, we had an IJ work group last year in 2010, so this was 2009, and the issues around interjurisdictional placement are nothing new. We've been dealing with this for quite a long time, and part of our working agenda in the 2009 meeting was we didn't really want to rehash the old obstacles and barriers. We've heard it play out so many times, so part of the work group for that was to come up with some possible solutions as to how various organizations even outside of child welfare, about how we could work together to remove some of those barriers and obstacles, and what have been successful things that have been done up to that point. I think what you will see, what happens in this video highlights some of those things that we heard, even though it came through some of the personal interviews. And I think when you see the curriculum that you also have the announcement for, you will also see that a lot of those things were addressed, because we want to move the conversation, as was indicated in the video, from what are the barriers and obstacles of what are people doing to move children forward, and how do you move past some of these things to affect change. With that too, we know that with interjurisdictional placement, there has been a renewed focus on trying to keep children close to their home. Proximity of placement, we've heard that being some of the issues that you have to wrestle with. The kinship placements, even within your own state, really diligently searching to do those things. What happens when you're trying to maintain some of those sibling connections? And we heard somebody talk about one thing that they were able to do for the siblings to be able to be okay with the separation that they were going to have and still be able to maintain some contact. So those are some things that even came out in the video. One of the interesting things I also heard was talking about the infrastructure. Well, how things are set up within your organization that help within your state to help facilitate interjurisdictional placements being able to occur. I think the particular quote she says is, where is your ICPC? Is it under your program area? And what is the communication like between you and that and ICPC office? That's not anything new to our discussion either. So, but those are a piece, and we're glad that we were able to have this ready by the time of this meeting to get some feedback from you. Do you think it's a tool that you will be able to use in your states? Do you think so?
Yes.
You think so?
Yes, and one of the things I thought was real neat, I think it was Natalie who pointed out that there are times when a worker may have one value related and the supervisor has another value, but how important it is for the two of them to come together and talk through what those issues are and come to the common table, that it's important for children for a placement. Because I think that was one of the things that we struggle with. There was an older generation within our child welfare system who just felt like, by God, kids need to stay in our state, in their counties, and there was no need to look beyond, even though they would be held up in foster care for years.
Wow, yeah. I think one of the things she highlights is that role of clinical supervision.
Correct.
And having a good supervisor that can help walk you through the process, deal with your own biases that you may have. And sometimes we see that the opposite way too. You see it the opposite direction too. But that's the piece that she does lift up, is the need to have good clinical supervision. And I would say most of the folks around this room, you're in your administrative roles, and the degree to which you have regular daily impact or work with supervisors in your counties and the work that they do, and informing what happens with interjurisdictional placement, I would imagine that varies. I know Oklahoma, you're a whole adoption program, everybody reports up to you, right? Right. So that system, you may get a little bit more information and have a little bit more direct impact as to what's happening. But with others, it's very different in how that information is communicated. So that's part of, if supervision plays such a critical role, how do we pass this information that you get here down to those supervisors, so when because we really are making, even at Adopt Us Kids, we're making a more concerted effort to reach out to states to register children, to get them photo listed. And we know from our history that we were going to get some responses from inquiring families. So once those inquiries come in, and I think part of the statistic was 75 or 80% of those families probably are going to be from different states. So how do we work with those supervisors and those workers to be able to communicate a possible placement across state boundaries is possible for this child, and we can be instrumental in helping that happen, and not that once they get that inquiry, they just do not respond to the family, because that's what the feedback we get, that there's no response when we tell them that we're interested in them. So we have to have a manner to be able to communicate that information down. Part of what we do with technical assistance is we can come in and help you do that, to bring that message and to work with those line supervisors and with your state administration when you really want to look at your interjurisdictional placements using this curriculum and the other resources like the Dollars and Cents Guide.
Can I ask a question?
You certainly can.
Can I ask a question of the other states? We've had some difficulty with moving children from our state to other states and having educational barriers. For example, Virginia, you have a lot of issues with the schools not accepting our children until the finalization occurs, or we have to pay their tuition. How are other states doing that? Because that's a real barrier to us, and then to get the state education department to pay, it's almost, I mean, by the time we get all that worked out, the family may have identified another placement and moved on.
I think you're going right where I was, the next place we were going to go. Thank you so much. I wanted to have a conversation with you, and you'll see this sheet right here, and we're going to talk through this. Initially, we were thinking to break you up into groups, but we have about another 10 minutes before we're through with this point. But I do want to hear from you, like what are those concerns, like the educational piece? And we can throw out a couple more when you think about interjurisdictional, and let's hear from others around the table as to what you've done to be able to deal with some of those. I saw a hand. Microphone. Thank you.
Carrie Lee with Alaska. And we're dealing with one state right now, and we have a child who's been approved. She's placed there through ICPC for quite some time, and the barrier we're running up against partly is our law. But the state contracts with a private agency. We're not privatized. So the state contracts with this agency to provide the finalized adoption services and finalize that adoption, and this other state pays that agency a certain amount of money for each child. Okay, we do adoption agency fees, that's not a big deal, but how we can't pay a third party, so how we do it in, how we've done it in Ohio and Georgia and a whole bunch of other states is we put it in their subsidy agreement, and we pay the family who does the contract and pays the provider. We can't do that in this other state, and we're just up against, until our regulation changes to allow us to pay a third party, the child's been sitting there for 6 months, ready to more than 6 months, but since we've been dealing with this. So we have that financial piece right there where it's like, this is just a really silly thing, but our law doesn't allow us to pay that agency, and that agency won't let the family pay them because that's part of their contract with the state that they work with. So it's an odd thing, but this is the first time I've run into that, and I'm just not sure how to work around that.
I was asking, with a report from the other state, could your family finalize
in Alaska.
Satellite in Alaska?
That was the question.
The other agency, the adoption agency, is saying no. They need this fee. They will not finalize. It's a very odd situation. So I'm glad to see you shake your head, Judy.
Yeah. Any more concerns or any more issues and I want to come back to the education. Has anybody dealt successfully with negotiating some of the educational components that you've run into? Who? Sharon?
We pay tuition to the out of state, and we just fight with our with DCPS about payment, especially when you're talking about special needs services. Yeah, I'm sorry. Yeah, we just our administration just go back and forth with the public school system. However, we pay tuition out of state.
Okay. So you guys have been able to come up with funds to be able to pay out-of-state tuition?
Yes. Well, for people who've been here for a long time, we know that in the District of Columbia, we do not have any suburbs. So the state of Virginia, and Stephanie's no longer here, the state of Maryland, that's the suburbs for the District of Columbia. So we have been paying tuition for a zillion years because most of our families are outside of the district. So the only way we can do it is by paying tuition. We have to pay tuition. So if a kid should go to Virginia, North Carolina, wherever, right now we're having a fight with North Carolina about auxiliary services. You know, it's one thing for the tuition, but now we're talking about speech and language and OT and what have you. So there's some issues, but that is handled between the public school system and that school system in the respective jurisdiction. But we pay tuition, and we've been paying tuition for many, many years.
So nothing new for you guys. What and she said, does she pay it as a service fee, or do you pay it as a part of your adoption assistance?
It's not part of the adoption assistance because our adoption assistance do not start until the adoption is finalized. So it's all part of the foster care, yeah. Yeah.
Okay.
Pardon me? No, because I mean, it's just business as usual. We've been doing it for many, many years. So it's not really a big problem for us.
Yeah. Brenda, were you saying that you guys do the same thing?
We don't pay subsidy until finalization. We just changed our law. So I don't remember having this problem in New York for our children finalizing foster care.
Yeah.
Yeah. We really haven't had a problem.
When a state asks us to pay, their Board of Education, we pay. I mean, we try not to hold up permanency for a kid. Now, sometimes the costs seem exorbitant, and we try to negotiate what's real, but we pay.
Is that anything you want to add to that?
Can you use 4E funding, or what other funding? Is it direct state funds, or do you know where the funding source is for your education? Because our state DSS says it's the education department.
There have been those, I've heard those arguments too. Is this?
Well, when you can work with the education to get them to do cost sharing, you do. And when they don't, they reflect on who has custody of the kid. And since we have custody, we pay. And our 4E revenue unit, that information goes to them.
Any other concern that was around the table that you want to bring out? Can you go ahead, Ann?
Thanks. Ann Carver, Arizona. I wanted to state that families often contact us after looking at the federal listing and want to pursue a home study for a child that they may have seen on Adopt Us Kids. And it's really difficult if,
you mean a narrative on the child, or?
Yes.
Okay, you said home study. Okay, they want a narrative on the child.
No, they want to then pursue a home study. They do not have a home study yet.
They've seen a child. Okay.
They've seen a child. They've seen a child, and perhaps they went to Adopt Us Kids because they've seen a commercial. And then they see the child that they feel fits in their family and want to pursue a home study, but they live in another state. At that point, it is challenging to get that family prepared to become an adoptive parent for that child or any child that lives in a state other than the state they're in. So that, yes, you're nodding. Everybody's like, yes, that's an issue. I know that we have a requirement to remove barriers, and we also have a we also have the ability to recruit and support families, prepare families. But it does seem like there is something still that needs to happen, perhaps even on a federal level, to encourage that preparation of that family. That, perhaps, for instance, that Arizona family, who Arizona and Arizona agencies know they're not going to be pursuing a child from our state guardian, or, under our state guardianship or state board from Arizona. There has to be something to push us along to prepare that family, despite the fact that that family is not going to accept a placement from Arizona. We don't know that that family will never, but when they have that explicit interest in a child from another state, it becomes an issue.
Okay.
She's tried to be.
I'm fired up.
She's tried to be quiet. I knew she was. I wouldn't even look at her.
I appreciate you bringing that up because I think it's the elephant in the room with interjurisdictional, and I'm not denying that. But it's a federal law that you don't delay or deny placements based on interjurisdictional, and so there's that. There haven't been the same penalties associated with it as there are with MIPA.
Right.
But I really don't think that that's what you want. I mean, you don't want to have penalties. And I think the positive way to do it instead, because I think it's not just ICPC. It's more of an attitude bias, which is why we tried to address that in the video. And we really do want your feedback if you think this will be helpful or if there are other ideas you have to help us. We know that you have limited resources and we know you have workload issues. My suggestion, though, is if you are very welcoming to families, because when families look on Adopt Us Kids, there are not that many kids on that website. It's less than 10% of the kids waiting in this country there's 115,000 kids waiting, and there's what, 4,500 kids?
4,500 only.
So it's like less than 5% of the kids are photo listed. Usually you guys only photo list them if you can't find a local placement and they're hard to place.
Right.
So when you have a family that looks at the website and sees those kids, they're already kind of interested in kids who look older or have significant issues, or their sibling groups, or their children of color. So I think a smarter strategy might be to welcome those people in and say, we are glad to have you. Because you know what, by the time they finish their home study, 9 months later, or however long it takes, that child that they saw may not even be available.
Right.
And then here you have a family that's expressed an interest in the sibling group, an older child, a child of color, or a child with disabilities, and there you have them in your pool. And if everyone would do that, so I'm not trying, I really want to thank you for bringing that, because I think that's what the real issue is. But I think we all have to put out the welcome mat. And it's a federal law. And not only, I don't even have to tell you it's a federal law, because I know that you all think that it's better for kids to get placements. And it shouldn't be easier to adopt a kid from another country than it is to adopt from another state.
Sharon. Thank you, Heidi.
Can I just follow up on that? Thank you, Heidi, because I do believe that that is an elephant in the living room as well. And I want to tell you that we do try to, we do take the opportunity. We have the luxury of having a centralized response team, and we take that opportunity to share about the kids that we have in our state that need homes today, and encourage them to move along in the process. But families that are entering the system that hear about how international adoption is easier than domestic adoption, so on and so forth. We want to be careful not to do the bait and switch, be transparent and with them, and perhaps there needs to be, I do think there needs to be something on a national level. Perhaps it is the talking points, perhaps it's the messaging around it, because we all know that these are all kids waiting, and we do want to do our part as a state. whether it's a child from New Mexico or Arizona, we know the circumstances of that child, and we want that child to have a home. But perhaps some universal messaging, talking points, something to help us have that conversation so that we can be transparent about the barriers and also encouraging and engaging to those families as they express interest in older kids.
Thank you. Sharon, I'm sorry. I saw two hands. John, can you give up? Thank you.
I would like to piggyback on what Ann was talking about, and it certainly is the elephant in the room. It's resources, it's dollars. And it becomes, for me, it becomes my issue. When we have a child in D.C. and there's a family in Ohio with a home study who's saying, I would like to take your child, and we need to enter into a contract with that agency in Ohio, and I'm saying we need money for this, and I'm hearing we don't have money for this, we don't have money for supplies, we don't have money for conferences, we don't have money for, we just had 115 people laid off. Then it's like you bumping your head against the wall.
Mm-hmm.
So I think this conversation, it needs to be elevated with our directors and what have you, because it becomes my issue and my staff issue, trying to find money to enter into a contract with an agency in Ohio in order to get this child placed.
Well, I don't have an answer, but I have another comment, and actually, Ann, it sort of is off of your elephant. Mine's in the dining room. I'm from Connecticut.
That's two big ones.
We are very welcoming to any family that calls us with kids that they see either on our website or Adopt Us Kids. And some of the conversations we have with families are they're calling us saying that their state will not release, or their county or their private child placing agency will not release their home study.
Yeah.
And so, what does one do? We always try to do the politically correct thing by saying everybody has a supervisor, everybody's got a manager, everybody's got a, please go up the chain of command, if you will, please push the issue, Is that rooted in a law in a particular state, or in a practice in a private child placing agency, or in a county?
I think I have two more, and then I think would hear that certainly. Yes, and then let's get this lady right back first. Yes.
I can answer some of that. I can tell you that we've started doing that, and the reason for that is because we have a situation in Idaho where our private agencies charge, let me think, about 3 to 4 times what the department charges for an adoption home study. And so we were having a significant number of families come to us claiming to have interest in doing a special needs adoption,
For a child in foster care.
going through our training, having us expend our resources to do the home study, and then they go out and use the home study for a private infant adoption. And so what we have started doing is, because we do not charge for training or for home studies for families who are interested in special needs adoption or foster care, so what we do is we'll go ahead and do the training and do the home study, but then if they wish to use the home study for placement of a child outside of our foster care system, then they do have to pay us the home study fee they otherwise would have been charged.
But in your situation, there wouldn't be an issue with Connecticut getting a copy of that.
Yes, we would not release a copy of the home study unless the family had paid us for it.
But if she's trying to get a child in Connecticut, they're inquiring about a child in Connecticut that's in foster care. They would have to pay you for that home study that you did in Idaho?
The family would need to pay us for the home study if they're using the home study for a child outside of the Idaho foster care system, because that's what the home study was written specifically for.
Oh.
And I know that's pretty consistent. We've actually run into that with multiple other states as well. In fact, that's where we started doing it, is because we were running into the same thing.
I can say when I was in North Carolina, we did not, if we did a home study, as long as that child was in the child welfare system, period, wherever they were found in the U.S., that we would release that home study free of charge to that agency.
Hi, I think Jill may be.
Oh, I'm sorry. I didn't see your mic.
Yeah, either one, it's fine. But I think that New Mexico has a similar policy that Idaho has. But I think what happens is that staff, it's a lack of education, it's a lack of training sometimes, because we have very similar things happen, that we do a home study and then the people want it for an infant adoption. But I think then when another state calls, they think that the same policy. So I think for New Mexico, it's not that we're necessarily going to charge another state or charge the family to go across state lines, but it's just, I think it's sometimes a lack of understanding, a lack of training, and which goes back to the video that you showed, Tamika, and that it's about relationships, it's about communication, and when we have those issues, for the ICPC person in New Mexico or Connecticut to contact one another, because oftentimes I think it's just a real lack of understanding on the part of the caseworker, or at least that's been my experience.
Yeah.
Thank you.
I just want to echo that it's about relationship as well. And coming from a state that has worked on changing the public perception of working with government, how important it is to train your staff, retrain your staff, then train again, put things in writing about, and we have worked diligently with our private child placement agencies. Remember, because our private agencies study those families for foster care. And then we have counties who have custody, care and responsibility for kids. And so if a family comes forward and they even wanted a child in another county, there were dialogues. And so we've now developed policy that says, if a private agency has studied, because we pay that private agency to do recruiting as a part of their fee, recruiting and preparation of families for foster care, for adoption, that they must share that home, they don't have an option, share that home study at no cost to the family or another jurisdiction in our state. If that family sees a child in another public agency, we apply it as well. If it's a private agency, however, for the purposes of a private or domestic adoption that child's not in the custody, care and control of another state agency, then all bets are off and they pay whatever the market will bear.
Right. So that's, okay, we're going to have to wrap this up. But I think what this really did show is that there's a lot that still needs to happen and a lot of conversations to be had around interjurisdictional. And even within your conversation right now, even within your states of how you do things internally and how that goes externally, that you could benefit potentially from doing some more work around that, because there's a lot of unanswered questions and then some myths that may be in the room that through training that we can help you try to resolve. If you have any additional questions or if you want to request TA, as I said, when you see that we have the curriculum coming out, we have the DVD. I'm going to bring some more of these DVDs and you don't have to bid on them. They've already been paid for. We can put them right back here on this table and you can please take them back and share them, and we really do want to. I think one of the comments that Heidi made, I really want to go back to it. Most of the children I think that we find on the website are those children who you have tried to place in your state and you have not been able to place them. So I think an argument can be made that they are really the children who need placement, that they're some of the ones that are really waiting. And whatever we need to do to try to facilitate that, whether it be myth busting or helping you problem solve to get that done, because they're probably going to be there, we're willing to do that with you. So thank you very much.
Thank you.